To item 3 on the agenda, which is topical questions, and this is the first time we've had topical questions under a topical question session. And the first question is to be answered by the Cabinet Secretary for Health, Wellbeing and Sport, and it's from Jerry Miles, who, Jeremy, had the first 90-second statement, I believe. So, trailblazing.
Thank you,
There you go.
Llywydd has shown great wisdom in selecting questions, as usual. So, will the Cabinet Secretary make a statement about his decision to approve the use of pre-exposure prophylaxis in Wales as part of a study?
Thank you for the question. I have discussed the framework for the study with both Public Health Wales and the Terence Higgins Trust, as well as officials within the Welsh Government, and I issued a Welsh Government following a meeting that took place yesterday with both Public Health Wales and the Terence Higgins Trust. But I do welcome the support from the Terence Higgins Trust to help promote access to Truvada, the branded PrEP measure that is available, and the wider care package that will be available throughout the course of the study.
Can I thank the Cabinet Secretary for his reply, and thank him also for the decision that he's taken in the last few days, and thank him for the time that he and his officials have made available to myself and others to discuss this important matter. The health, emotional, relationship and social consequences of HIV diagnosis can be very, very serious, and although many people are living into later life with HIV medication, it's incumbent on us to make available to people in Wales the tools that they need to manage their health prudently and to reduce HIV transmission. The clinical effectiveness of Truvada is well established, between 86 and 100% effective at reducing HIV transmission as part of a range of safe sex measures. So I welcome the decision that he has taken. He has mentioned that this will be rolled out across Wales. Can he confirm that it will be available across Wales from the outset, mindful of the fact that there is an uneven distribution, if you like, of GUM clinics across Wales? Secondly, from the perspective of the patient, will participating in the study alter that experience for the patient? Will there be additional expectations from the patient above and beyond the clinical expectations? And thirdly, what measures does he envisage being taken to raise awareness amongst communities that are particularly at risk of HIV transmission of the availability of PrEP on the NHS in Wales?
Thank you for that series of questions. I think you're right in terms of awareness raising to start off with, that there is a real challenge in continuing the message about the reality of HIV and reducing the number of people with HIV in Wales. We still have people every year who contract HIV in Wales. There is a real need to improve our ability to reduce the numbers of people who have HIV and then the treatment and care for them as well. There is something here about both the decision and the awareness around this, because we recognise there are groups of people who are likely to be at risk of HIV, or indeed who may have it, who are reticent about coming forward. So actually having a study and the way that's undertaken should help us to understand the levels of people who are at risk and actually the economic benefits of PrEP itself as well. That's part of the reason behind the study, but also seeing it within that wider context of care provided too. I expect the study to start by the end of July this summer. So it will start within a matter of months. It will be, I can assure, it will be available across all Wales. It won't be in particular parts first or afterwards. So it is a genuine all Wales approach. And every single person where this is clinically appropriate will have PrEP made available to them. No extra hurdles or barriers to get over. And I think it's also important to make clear that this will be primarily undertaken through GUM clinics. And I know there's a challenge through Mid-Wales in particular about the availability and access to them. That's part of the challenge in designing this and in getting people access to an appropriate place to have that care and follow-up support undertaken. But it's where most people access their support and advice on these areas. People are less likely to go to their general practitioner for this particular form of support and advice. So that's why we're making sure in the design of the study that GUM clinics will be the primary place both for the prescribing but also the follow-up treatment, care and testing and understanding about adherence too as well. I'm looking forward to receiving back from Public Health Wales clearer parameters about the study, how it will be undertaken and the assessment of the value and the impact of the study and the learning on the behaviour of individuals who are at most risk as well. So there's lots of learning we can get from this. And I look forward to being able to update members, hopefully before recess, about where we are in the start of this particular study. That will be another part of awareness raising, but the particular what we will do with third sector organisations like Terence Higgins Trust and others to raise awareness from those most at risk as well. So very pertinent questions that are absolutely in my mind as we take this work forward.
Thank you. Mark Isherwood.
Glan Clwyd. The results of the UK-based 2015 PROUD study evaluating the effectiveness of HIV pre-exposure prophylaxis, or PrEP, amongst the high-risk group of gay and bisexual men showed that daily use reduced the number of HIV infections by 86% in this group, and that when taken properly, the effectiveness was nearly 100%. Noting that, how do you respond, given your comment about your engagement with Terence Higgins Trust, to their call for this to be provided alongside other prevention interventions, such as condom use, behaviour change and regular HIV testing?
Well, I'm happy to confirm and respond. That's exactly what Jeremy Miles has called for. It's exactly what Terence Higgins has called for. And it's part of what the study will be looking at. It won't just be PrEP in isolation. We're seeing it in its context as part of the work that we want to do to try and ensure that as many people as possible do not acquire HIV. So it's an important part of where we are. And it's also understanding the real level of incidence rates that exist in Wales, because we do think we probably undercount and underestimate what they are. So there are real challenges that we understand from the advice we've had from the Always Medicine Strategy Group. But we are looking to resolve those by having this study and making sure that PrEP is generally available across the whole country for everyone where it's clinically appropriate. That's a really important step forward for us here in Wales.
Very much. And the second topical question this afternoon, again to be answered by the Cabinet Secretary for Health, Wellbeing and Sport, is from Darren Millar.
Thank you, Deputy Presiding Officer. Will the Cabinet Secretary make a statement into the investigation being undertaken by the Betsi Cadwaladr Health Board into reports that the quality of care for dementia patients on the Tawel Fan ward at Glan Clwyd Hospital may have contributed to at least 7 deaths?
As the member and other Assembly members will be aware, I established an independent panel to oversee the HASCAS, that's the Health and Social Care Advisory Service investigation, and the Donna Ockenden review into the care of patients on Tawel Fan. Whether the quality of care provided could have been a contributing factor to the death of some patients will, of course, be what we're looking to establish as part of that HASCAS investigation.
Thank you for that answer, Cabinet Secretary. These are very concerning remarks which have been made in letters to patients' families in North Wales, and given that we are now 2 years into special measures, almost, and around 2.5 years since the publication of the report by Donna Ockenden into the institutional abuse on the Tawel Fan ward, it will come as a serious concern that there may be individuals who are still employed by the NHS, paid for by the taxpayer in terms of their salaries, who are yet to lose their employment and are yet to have to face resignation and may still be working somewhere in the health service in spite of the potential harm that they may have caused to individuals in this particular ward. And I am concerned that some of the cultural issues which were identified in Donna Ockenden's report are still prevalent in mental health services in North Wales, and that there's still significant pressure on inpatient bed capacity. Just this week, I had an email from a family whose loved one needed to be sectioned because of their poor mental health and had to be sent to Bristol because there were insufficient numbers of beds in North Wales. That is unacceptable, and it's also unacceptable that some patients are having to sleep on sofas in lounges in mental health wards because of insufficient numbers of beds, and that some female patients are also having to sleep on male mental health wards in North Wales. Clearly, there are still huge challenges. There are still issues which people in North Wales are facing, and we must ensure that we learn lessons from what went wrong. And I appreciate that the investigations are continuing and that those are in-depth investigations. We have to get to the truth in terms of what has been going on in North Wales. But I would appreciate it, Cabinet Secretary, if you could give us some assurances that should those investigations find that harm has been caused, that you will discuss with the police and the Crown Prosecution Service the possibility of bringing prosecutions for those responsible for causing harm, particularly where that harm may have led to deaths, because these are very serious issues which people are very concerned about in North Wales, and we're not confident that sufficient progress is being made to address those concerns.
Thank you for that series of slightly different questions that I'll try to answer in the different parts in which they're put. I want to start by saying, of course, I understand the significant and continuing public interest and concern into the events reported around Tawel Fan, and it's been actually very difficult to meet the understandable demand for a process to be concluded as quickly as possible, which is entirely understandable from the families affected and the wider concerned community within North Wales and beyond. But having a process that is properly robust, because part of my concern has always been, despite my personal desire to see this concluded quickly, that if you don't have a properly robust process, you potentially open up not just the health service, but individual families to a wholly unsatisfactory position where the process itself collapses and you don't actually deliver the sort of justice and understand that people want to see. And I do appreciate the fact that you indicated that the most important thing is to get to the truth. And indeed, thousands of different documents have been reviewed, and because of the rigour undertaken, there's been further fields and avenues of investigation undertaken that go beyond the number of people identified in the Ockenden report. And that's important for you to understand, I think. So there's real rigour that's been undertaken in what is now a review with real, genuine, independent oversight. So the Health Board don't control and have oversight of the HASCAS review. So there should be no misunderstanding the Health Board are somehow going to reinterpret or alter the findings of this generally independent review. I've not had sight of the letters that I understand have been reported, but in terms of the challenge around harm caused and understanding what comes after that, there will be a number of different processes to go through in which the government won't have a role to undertake. For example, the professional issues, that will be for the professional bodies to undertake. We expect them to do their job. I am concerned about the length of time it takes for fitness to practice proceedings to be undertaken. That's not a party political, it's an issue of genuine concern across the chamber, regardless of which professional body people are responsible to and for. On the point of prosecutions, I think it's really important that government politicians don't get into a position where we are saying that we expect or require the police and the Crown Prosecution Service to prosecute. There is such a level of public interest that I expect the police to be properly aware that when the investigation reports, they will need to review it and they will need to respond and indicate. And at the time when the report is available, I see no reason for me not to ask the police to confirm their position. But I think going beyond that, I think that would not be appropriate for me to do. Those are independent decisions to be made by both the police and the Crown Prosecution Service about matters that they think they could, should, and have a duty to investigate, and then conclusions they actually reach. But I'm happy to, at the end of this process, to ask the police for their view and whether they expect to take any further action. On the broader cultural issues that you identify, I think this is an area where people should look again at the process of special measures with the oversight provided by regulators. Isn't a government politician deciding this is what I want the conclusion to be? And I've always, and I know that Mark Drake before me, we've always tried to be really clear. This won't be undertaken for the convenience of a government politician in this particular role. It must be about independent advice from regulators about the progress that has and has not been made through special measures, about where the organisation comes at, whether sufficient progress has been made in each of the areas. And mental health services are, I think, the most significant area of concern that caused the Health Board to be put into special measures. The new director has made a real difference, I think, but there is an understanding there's a real and significant challenge in reconfiguring and improving that service. What should give me and other members confidence is not just the process undertaken with independent regulators, but they recognise that real progress has been made to date, but it is about the further progress that is still needed. And I would not pretend to you or any concerned citizen that everything is perfect and the progress is smooth and easy. But we will have a properly transparent review from those regulators when they undertake their regular review of special measures. And again, I will receive that, and that will be publicly available, as have previous reports.
Thank you very much. Simon Thomas.
Thank you, Deputy Presiding Officer. And clearly we have to await the full investigation before we can make any decisions, or before any of the professional bodies can make any decisions about what consequences might flow on from that. So I agree with what the Cabinet Secretary has said and note his strong words in that regard. However, there have been administrative consequences from Tawel Fan. The Chief Executive was suspended, and then in turn, as the Minister has just outlined, the Health Board itself was taken into special measures. So I want to understand what he's done as the Cabinet Secretary around the administration now of Betsi Cadwaladr, and two things in particular. Can he just confirm that not a penny has been paid to the members of Betsi Cadwaladr Health Board after it was taken into special measures? Because it would be wrong, wouldn't it, for failure to be rewarded in that way? And secondly, can he also confirm that no money has been paid to Professor Trevor Pert after he began work in England?
On Professor Pert, we were completely clear about the secondment arrangements for him to leave the health service in Wales. He's now no longer part of the service. We're absolutely transparent about the arrangements for him to leave, including the financial measures that took place with that. In terms of your comment about that members of Betsi Cadwaladr Health Board have not been paid a single penny, I assume that you don't mean the members of staff who work for Betsi Cadwaladr, but you're talking about the members, the independent members who are appointed. Well, they're still undertaking a role. They're still acting. And if I took the decision that they should not be paid, I should actually just simply remove them rather than simply say I'm going to punish you by effectively taking a disciplinary measure to remove the monies that you're entitled to and undertaking this public appointment. I think it's really important that in properly holding people to account, that we don't look for easy or headline-grabbing measures to try and say this is what we should or must do. For me, the most important thing is that the Health Board improves. You do need members who are committed to providing the scrutiny that wasn't undertaken to the level we'd wanted to in the past. We've seen a review of people. We've seen and actually a renewal of people as independent members on that Health Board. We've seen new executive members come in. So there are new leadership arrangements in place within the Health Board. A new executive nurse director, a new medical director, and a new chief executive officer as well. And so it's really important to understand the leadership has moved on from the time in which the organisation went into special measures. And for me, it must always be, are we seeing progress being made? Are we getting the independent reassurance from regulators that real progress is being made? And what are the continuing challenges that we need to see resolved within Betsi Cadwaladr? Because that, for me, is the most important thing, because I want people living in North Wales to have the same high-quality health service that I believe every citizen in any part of Wales is entitled to.
Mark Isherwood.
Diolch. Well, the Health Board website states the board was made aware by families of serious concerns about the care of patients in December 2013. Immediate action was taken to close the ward and patients to be transferred to alternative care. However, I wrote to the Chief Executive of the then NHS Trust, North Wales NHS Trust, in April 2009 on behalf of a constituent, stating the treatment received by her husband in the unit nearly killed him, that 3 other patients admitted around the same time as her husband had similar experiences. She was now worried about the treatment others may receive in the unit. Her husband had Alzheimer's disease and terminal cancer. And through that, I was copied on the complaints of another patient who had vascular dementia, which included distressing before and after photographs. The Chief Executive responded it was to be treated as a formal complaint, that she'd copied my email to the Chief of Staff for Mental Health and Learning Disabilities. How, therefore, will we ensure that this inquiry not only considers the impact on the patients and the families, but considers why matters raised with them several years, 4.5 years before they acknowledge that they were made aware of this, having been raised with them at the highest level?
I think it's difficult to understand how the matters raised directly relate to the investigations being undertaken. You raise matters that are historic, going back to 2009, as you indicate, and others. I'm not aware of how the independent HASCAS investigation has actually resolved all of those issues, and is look at, because that's the whole point about being independent. It's not for me to set parameters on the timescales for them to look at or to understand. It is for me, though, to understand that it's a properly rigorous, robust and independent investigation into what took place in the care provided around Tawel Fan, the lessons to be learned from that particular part of the service, but also there are wider lessons to learn about the future of the service, not just in North Wales, but beyond. So if the member believes there are matters that he wishes to draw to the attention of the independent group overseeing the HASCAS investigation, then I think it's perfectly proper for him to do. And it must be for them to undertake that investigation as they see fit, rather than me deciding for them what they must do, because that then means it is not an independent investigation and inquiry. And I think it's really important to protect the independence, the robustness and the high quality and searching level of detail that inquiry is undertaking. I look forward to receiving the outcome of that investigation report. We'll then need to understand what we do collectively to move healthcare in North Wales forward afterwards.
Michelle Brown.
Thank you, Deputy Presiding Officer. Any investigation needs to be undertaken thoroughly and fairly, of course, but how will the Cabinet Secretary ensure that the investigation is conducted in a timely manner? How will the Cabinet Secretary make sure that any findings are not simply written off by the stock line that seems to be used when a public body is found to be failing our people, which is lessons will be learned? And finally, would the Cabinet Secretary ensure that the results of this investigation are brought back to the full Assembly, not just the Scrutiny Committee, for debate on next steps?
I'm happy to respond to the middle point first in terms of what will happen. Well, in terms of what will happen after, we need to see what the report says first, to then understand what is an appropriate response. What is the response that the Health Board should undertake? Are there points of the government to respond to as well? I'm robustly confident there will be questions as a result of the report when it's provided. And of course, we need to consider with the Leader of the House about how government business is used in terms of responding to that report when it's provided, and having a proper response that actually informs rather than simply adds more heat to public debate around this matter. It's really important we take a step forward rather than have an exercise in launching more criticism into individuals who are not here, but actually look at what happens for people who need the service at the highest level of quality within North Wales. And finally, the point of the timely manner of providing this report. For me, the most important point is that it is a robust and independent report. I personally would have much preferred if this report was available several months ago. It would be much more convenient for me if that were the case. But I cannot, and I could, but I will not interfere with the timescale for this report. Otherwise, as I say earlier, it is no longer an independent report. And it must not be a report that is done with the convenience of a government politician. It must be a report that carries real independence, real rigour and real robustness with it. And that means, unfortunately, it's taken longer than any one of us in this room or the families affected would want it to have done. But the robustness and the independence of that report should not be compromised, and I will not do that.
Thank you very much, Cabinet Secretary.